Hey guys, this is Garrett McLaughlin. I want to take a quick second and talk about anterior hip tightness for cyclists and triathletes. Again, I say tightness because a lot of times, a lot of my clients or new clients come to me and saying, yeah, I feel that this tightness or the sensation in the front of my hip when I bring my knee up to my chest, or when I'm sitting on the bike and I'm in kind of a low position like that. I'm feeling this tightness in the front of my hip. If we think about what tightness truly is, tightness is some kind of muscle or joint motion that's restricted as far as range of motion. It's usually not on the compression side though. If I was feeling tightness in this hip, typically it would be more towards the glute or hamstring if I'm in this seated position like this, or if I'm on a bike in some way. If you're feeling tightness in the front of the hip, it's typically more compression. So that joint, for some reason, is becoming really compressed between the ball and the socket. Again, could be some kind of structural change in there from always being in that position, maybe sitting at work and then years of cycling or triathlon training. Could be some kind of changes within the joint itself, but a lot of times it's actually because how the joint is sitting. So if you look here, ball and socket joint, so this ball and socket joint is very centered right in the middle. A lot of times from a lot of extended sitting, cycling, being in that crunch hip flex position, our joint will actually, the femur will actually slightly start to slide forward. When that happens, and then we're in this seated position, as that leg comes up, we get more pinching in the front of the joint, so that's more compression. It's not actually tightness. What we need to do in those instances is get the femur to pull back into the joint, because then it has more ability to move into flexion without getting pinched here in the front. So actually improving centration of the hip, of the femur in the socket and the acetabulum will help improve that situation. So first thing I like to do is actually work on the soft tissue around the front of the hip flexors, your psoas, your iliacus, rectus femoris, some of these hip flexor muscles. So if we go getting some kind of trigger point ball, typically a foam roller is going to be too thick to be able to get through here, because obviously you think we have to kind of navigate right around the pelvis here, the anterior superior iliac spine, some of these bony structures through there. So if we lay face down on a trigger point ball, I'm trying to scan and find right that bump in my front of my hip and just work just inside there. Nice deep breath. Again, typically a little bit uncomfortable for a lot of people, but I'm going to scan up a little higher than I think I need to be, almost towards the belly button. So I'm drawing an angle from the outside of the hip towards the belly button. I'm going to scan up towards there. You think of that's where the psoas runs, all the way deep into the lumbar and lower thoracic spine. So I'm going to roll that for a second. What I want to do from there is actually changing my typical hip flexor stretching and make sure I'm doing that correctly. If we are doing hip flexor stretching here and we're just aimlessly lunging forward, yes, you typically feel a lot of lengthening, what feels like stretching through here. A lot of times, if we aimlessly lunge forward without setting up this hip properly, we're actually getting the whole joint capsule. So the joint capsule are how all those, the muscles, the ligaments, all that fuse into the front of the hip. We don't want to get the joint capsule itself. We want to stretch the musculature outside of that. So this might actually start to cause some of our problems as well if we're not stretching correctly. Just to change that, all I want to do is dig my back toe into the ground, kind of pull that hip backwards. If you think of what's happening there, I'm automatically engaging my glute. So if I get this contraction through a big strong muscle here through the back of the hip, it actually starts to pull the femur back into the socket, as opposed to it just letting it lunge forward kind of aimlessly out of position. So from here, digging my back toe in, and then nice controlled lunge forward. You'll notice if you do that correctly, you only need to lunge about an inch or two, and you'll feel that front of the hip open up and really stretch a lot better. Okay, so that's a good place to start. From there, because what we notice is that compression is more of a joint issue, we want to actually address the joint. So there we did a stretch of some of the soft tissue surrounding the joint, the front of the joint, the hip. But now if we throw a band on that lower side, what we're going to do is add some tension to pull that hip back in the socket. So here, this is the same exact stretch. Nothing has changed as far as the stretch, but now I'm trying to add as much tension from this band as possible. So I'm getting on there, that band's really pulling back, I could feel it. I'm gonna set up in position nice and tall, not letting this completely pull me out of position. And then same stretch, digging my back toe into the ground, engaging the glute, small lunge forward. So this is almost like a stretch with a joint mobilization built in. What do you think of? You're getting that pinching in the front of the hip. So now in this position, we're opening up that hip, getting it back into the right position, and restoring that centration of the joint. So I can hold out there. I can do Small rocks back and forth, okay? But sometimes sitting out there 30 seconds, even up to 2 minutes is a pretty good thing to do. From there, it's always good to look at the opposite muscle group. So we talked about a second ago how contracting the glute pulls that joint back into the proper position. So we might want to work on some kind of glute strengthening to help improve the position of that joint. So a lot of times if the glutes aren't firing properly, that's when we'll start to lose that. A lot of tightness up through the hip flexor, pull the joint forward, lack of strength and too much lengthened glutes will cause that joint to sit forward. So if we go and add some glute strengthening here, just getting in, squeezing the glute, driving up. Again, that's a good starting point. Hitting that, again, always good to do something like that, both sides. Once we finish that, going into some kind of hip bridging, either regular hip bridging, driving through the glute, squeeze the butt, drive up, or a single leg, one of my favorites, the cook hip lift. Stick the heel in and lifting up. Okay, same thing, always good to do on both sides. Some of that glute activation and strength, but that's a great way. If you're noticing you're starting to develop or have felt tightness in front of the hips, start to consider that it might not actually be a muscular tightness, could actually be compression of the joint. Add some of these strategies in there. Again, it is a challenging thing to help clear up on your own, so let me know if you still have any kind of difficulties or struggle with that, and hopefully you can troubleshoot and find you a better solution.